Hi, I'm Dr. Group. Welcome to my video questions and answers blog. Today, this question comes from Melissa H. Dear Dr. Group, I've been using Oxy-Powder for about a year now and I love it. I suffered from IBS for years with no relief from any product until Oxy-Powder. Thank you for your dedication to making the world a healthier place. Thank you, Melissa. I appreciate that. My question is, my daughter also suffers from IBS. I gave her the Oxy-Powder and her blood pressure shot up and she did not feel well. Her doctor told me it was probably Oxy-Powder and she should stop taking it. She did and her symptoms abated. She does not take medicine for her blood pressure and she has type 1 diabetes. Diagnosed at 10, she is now 26. Since Oxy-Powder is all natural and is supposed to help lower blood pressure, could this really have been the cause? I would love to see her have results. Do you have any suggestions? Thank you for your time. That's a great question, Melissa, and I thank you for asking that. First of all, Oxy-Powder was studied specifically for IBS, and it was studied in FDA-approved Phase 1, 2, and 3 clinical trials. And we achieved a good success rate in those clinical trials. I would suggest that anybody who wants to view those IBS clinical trials go to oxypowder.com and then click on the research tab, which will take you to the clinical studies. As far as your daughter's concerned, she's now 26 years old. We definitely have not stated or made any claims that Oxy-Powder is good for blood pressure. Although the magnesium in there, most people think is dietary magnesium, but it's not. I mean, the magnesium is more or less just there to hold the oxygen content and to act as a stabilizing agent. Very little magnesium, dietary magnesium or elemental magnesium will be absorbed into your body when using Oxy-Powder. You know, we've even when we did extremely high doses of Oxy-Powder, we still did not notice any change in blood pressure, and we even tested to the equivalent of taking a bottle of Oxy-Powder practically twice a day, and we still saw no rise in blood pressure and anything else. I'm not sure that if the Oxy-Powder was taken close to when she took her insulin, or what she had to eat that day. Again, this is very hard for me to determine, not knowing what your daughter's dietary habits are and not knowing the full history on your daughter. What she could do is just try taking Oxy-Powder 2 hours before or 2 hours after her medication, maybe starting with one capsule and then slowly regulating and see if that has anything to do with her blood pressure. As far as her doctor telling her it was probably the Oxy-Powder, very common. I mean, all doctors are going to do is they're going to, the majority of medical doctors out there, that if they know that the patient is taking a natural medicine, most of them, unless the medical doctor has been trained significantly with alternative or natural medicine, are going to blame anything that happens on, anything else besides the pharmaceuticals. When we all know well and good that the pharmaceuticals and the medical, community is basically, harming us every single day with pharmaceuticals and vaccinations and everything else they can, put down our throats that are not going to cure anything, but all they're going to do is cover up the symptoms. I mean, you have to address the root cause of the problem to get results. And in this case, I would definitely recommend that you read my book, Health Begins in the Colon, because you will get valuable information. And if you and your daughter follow the instructions, cleaning up your living environment, cleaning up your body, your daughter should be doing a lot better. And I just want to touch real fast on the type 1 diabetes that your daughter has. I would definitely recommend 3 liver and gallbladder cleanses. It really helps the pancreas kick back in and really helps the liver produce more bile and help all the symptoms of diabetes as well as controlling the sugar levels. Thanks, Melissa. Great question.